Hi everybody, this is Dr. Ihab Abdurrahman Ihab Tarawa, consultant of acute care medicine at Soba University Hospital, professor of medicine, University of Khartoum, dean of Sama Institute of Health. In this session, we are going to discuss being an effective team player. This session is part of patient safety sessions. Learning objectives, we would like to discuss the performance of teamwork in healthcare. Describe how to be an effective team player. Explore factors affecting team interactions. First, let us define what is a team. A team is a group of two people or more. They interact dynamically, interdependently, and adaptively, have common goal or mission, and they are assigned specific task, possess specialized and complementary skills, and usually uh, they have limited span of membership. For our patient, it is just part of the healthcare delivery. They get exposed to different teams in the emergency room, in the floor, in the operating room, in the x-ray suite. Even in these different geographical areas, they get exposed to different team, and each team sometimes is composed of different people: consultant, specialist, senior resident, junior resident, a nurse, nurse, administrator. Plus they get exposed to ancillary and other people. Clinical and ancillary care of patient in hospital is provided by large diverse team in healthcare. They differ in their size, diversity, variability, complexity of these teams. So as you see here, the pathway of management team, but there are many integral and core team and many tangential and collateral teams. How do teams improve patient care? Teams represent a pragmatic way of improving patient care. Team can improve care at the level of the organization, patient outcome and safety, team as a whole, and individual team member. As a team member, you learn from others. If you have certain skills, if you are good in putting central line on peripheral line, then you learn from the guy who do the airway. And as a whole, for example, resuscitation team, you can improve your dynamic interaction and outcome, and that is patient well-being and patient safety, and this will get reflected at the organization level. Tuckman describes that team goes through process of forming, storming, norming, performing. Initially, when we make a team, we try to get complementary skills together. Then they go through phase of storming, and here conflict will arise. But if there is good team leadership, they can manage that conflict. Then people they understand each other, especially if there is clarity of role. Then they norming, and then they go through performing, and then output will be shown. Team has its identity. Some people they are they don't know their role, they stay very vague in a team, but when you know the team identity and your identity in the team, you can do well and you can perform well. Human need to relate to those around them. Strong team identity provides the feeling of safety and support that enable individual to do their best work. Team identity enables organization to order work in a way that reduce duplication of effort and enhance synergy. Task identity has been found to contribute to satisfaction of intrinsic in individual needs, and therefore influence variety of useful outcomes such as reduction of absenteeism, increased work motivation, high quality work. So team identity is very important for the individual and for the team itself. So you have your identity in a team and your whole team identity. What make for successful team? Effective team possess some of these features. They have common purpose, they know their goal and it can be measurable, and they have effective leadership that can manage conflicts, conflict resolution, and they have good communication. And we have a session about structured team communication, team cohesiveness, and mutual respect. Respect is a very important factor in team success. Situation monitoring, situation awareness, self monitoring, and flexibility. So, for the team, they have their technical skills, but they also need a lot of non technical skills. Cognitive skills for decision making, social skills for how they interact with each other, personal skills that enable you to interact with the team. You need to recognize how to utilize the available resources. So these non-technical skills are well known in aviation and high-risk industry, and they compile them for the sake of teaching and performing into situation awareness, decision making, teamwork and leadership, and coordinating efforts. Situation awareness, it's about understanding and anticipating the impact of a specific situation on performance of worker and patient outcome. For example, if you have someone with neutropenic sepsis, if you are aware that these patients they go downhill quickly, then you monitor them quickly and then you provide needed isolation. Example for situation awareness, requesting further information, confirming the validity of physiological information, checking and monitoring, anticipating patient next need, and confirming this perspective with other team member. Also, non-technical skill include decision making, ability to identify options and their availability, and the competency of staff who can deliver them, incorporating risk assessment with this option and taking time to re-evaluate progress and response if necessary, recognize failure and changing direction in a timely manner. Also, part of the non-technical skill, coordinating effort, planning and sharing the plan with the team member, preparing and prioritizing the actions that need to be taken, identify the resources necessary to achieve the planned task and performing them to an appropriate standard. Leadership is very important. This is very important non-technical skills. Effective team leadership, coordinate and facilitate teamwork. You need to know the competency of your team member, and then you can delegate the task accordingly and give them assignment. Communication is crucial, and we have specific session for briefing and debriefing, and also spark communication and closed loop communication. Conducting good communication is very important for maintaining your team, empowering your team member to speak freely and ask questions, and this is part of culture of safety. Organizing improvement activity and training, you have to identify their training need and then you facilitate that. Inspiring followers and maintain positive group culture. Part of the leadership, team leadership, accepting the leadership role itself, and it's a challenging position. Calling for help appropriately. Whenever you need help, you need to identify your limitation and ask for help. Consistently monitoring the situation, setting priority, and making decisions, utilizing resource to maximize performance, and learn from situation and make it better for the next experience. Whenever there is team conflict, you need to resolve that and to work for conflict resolution, balancing the work within the team. Team, they need to know their role clarity. Team are created to enable people with different knowledge, skills and experience to come together and create synergy. There is evidence that also that role clarity increases team member confidence and job satisfaction. Role clarity and mutual understanding of roles amongst team member is essential for creation of synergy. Team process, it require good communication and including structured communication, participative safety, and this will be discussed in detail in culture of safety, team interaction, and we have to arrange for regular meeting in different way, real life meeting or virtual meeting, and we have to build trust among team member, constructive debate which is characterized by openness, concern for quality and tolerance for diversity, and we should have a way to manage conflict. Sometimes the teams they don't do well, there are some barrier for teamwork when there is changing roles. Medical hierarchy influence team performance, and there are certain tools. When we will discuss the culture of safety, we can talk about how you can challenge hierarchy that doesn't work well for patient safety. Individualistic nature of medicine, instability of the team. Sometimes the team get changed every now and then. Frequent change of team member can affect the team performance. Team performance and teamwork can be assessed by outcome in workplace and sometimes in simulation, like calling for a fake code blue and videotape it, and then you can assess the performance of individual and of the team members. Team can be assessed by internal or external expert. In summary, take home, team is an integral part of medical practice. It is almost impossible for the patient to receive hospital care or general care without being exposed to different teams. There are well documented teamwork principles for team building and management, and there are a variety of techniques that have been developed to improve team communication, team performance. And thank you.